Good afternoon, Keisha. How's it going?
Pretty good. It's a rainy day in Connecticut, which actually helps me slow down. So it's good.
Yeah, it's rainy here too, but Memorial Day is supposed to be really nice here tomorrow. So we'll check it out then. Today on PathGab, we're talking about pathology reports. What does it mean? What are the components? And why are you seeing it sooner than you used to? And sometimes before your doctor does.
You used to be able to get them before, and some people were better at navigating that than others. But in 2016, the Cures Act was passed. And this is the Cures Act. This relates to healthcare, not the Cure Act, which I'll leave you to go look up on your own. We're talking about the Cures Act here. But the Cures Act had several parts to it. But the part that's relevant for us today that we're going to discuss in relation to pathology is the patient access piece. Because in the Cures Act, it required that patients get access to their electronic medical record or their electronic health information in a very convenient form. And that was basically a game changer for how pathology reports get issued.
Yeah, and I guess it wasn't just a convenient form, it was also in a timely manner. So I think we were all held to a standard now that reports pretty much with few exceptions, as soon as they're signed out, need to be available to the patient.
Right. And so that means in reality, many patients get their pathology report and their lab results. Where it's pathology and lab, but we're going to talk a little bit more about pathology today. It's pathology and lab, but many patients will see those or know what's in them long before their doctor does. And that's huge, right? There's no delay in results. So some of the implications are that your doctor has not reviewed this yet.
Right. And or just hasn't had a chance to call you first to let you know what's there. And of course that's like can be really anxiety producing if you're a patient and you get one of our pathology reports that might say attention or on some occasion report of malignancy on there. That can really raise the anxiety when your physician hasn't had a chance to call you and say, "Hey, let's talk about these results."
First of all, what's on your pathology report? Well, for most of us, there's a header. And what's the
Mhm.
header? The header is the part that has your name, your date of birth, your gender, the day you came to get that kind of test done, the pathologist who's signing out that test, the doctor who ordered that test, the location that test was collected in. Sometimes it will have your medical record number, and sometimes it will also have maybe your patient financial accounts number, things like that. So general information. And it may go without saying, but when you're getting your results and you see that kind of information, you do want to cross check it. You just want to make sure, is that really me? I pretty much would safely say near 100% of the time there is no error there. But if I were advising a patient who's looking at their results, that's the first thing I want to cross check, right?
Yeah, yeah, I totally agree. And I think it's just good information there too. Like if you do happen to have a question, and some people have a lot of touch points in their healthcare journey, and some people maybe you're just coming for your annual physical exam. So to know which doctor ordered that test so you know who you can call and potentially of course your pathologist who may have like read that test so you can know who you can potentially call. All those numbers and names are on the report, so that's how you figure out who you need to talk to.
Sometimes in that section, you'll also have the other doctors who got a copy of the results. So let's say you went to radiology and radiology did the biopsy, right? But your endocrinologist sent you there. So you can see usually in that section, or depending on the style of the report, maybe at the end of the report, did it go to your endocrinologist too? Did it go to your gastroenterologist? Did it go to your primary care? And that's kind of helpful to know. Does everybody have the information by the time you will call them? They may get it after you see it, but at least you'll know then, did they even get it? So those are just like basic, what we call maybe like demographic slash logistical things about the report.
The next section you might see in your report is called final diagnosis. This is where your pathologist has decided what we need to tell you about the piece of tissue that we got from you. You may see some common phrases there like normal, benign, no pathologic diagnosis. Hopefully, when you see these, I want to help you reduce your anxiety. This means you're fitting normal patterns of histopathology. On occasion, you are going to see something that is questionable. Maybe they'll say uncertain, could be, the differential diagnosis includes, and that they're just trying to indicate to you that there's some uncertainty here, and perhaps that additional testing might need to be done to get to a more definitive diagnosis. And that can include more pathology, it can include more radiology, it could include more blood work, it could include more history, just like to know what's going on from you. So sometimes we have to have more information to get to that definitive diagnosis. And then, as we alluded to earlier, sometimes you are going to get that report of malignancy, and you might see something like carcinoma, lymphoma, sarcoma in your diagnosis field. And like we said, you're usually going to see something at the top that will say attention, because that, of course, is a very important diagnosis that needs to get through, and everyone needs to see it.
One of the biggest things I could urge anyone, and we'll talk about the other parts of the report that you may see and not know what's in there, is when you get your report, be patient with all of your doctors, your pathologists, the physician who sent you for the biopsy or did the procedure, because first of all, as pathologists, we've been writing diagnoses in a particular way from the beginning of time. And then only between 2016 and now are we thinking, well, wait 1 second. We have to write it in such a way that our doctors understand it. We use the scientific jargon, but patients who are reading it understand it as well. And I don't know if we've caught up. I haven't caught up. Sometimes I look at the report and I think to myself, ooh, I could have said that better, because I don't know if there's a good way for someone who doesn't have a medical background to understand that. So as a patient or as someone looking at that record, you have to understand that it was not originally designed for you to read it. So we're catching up, but you have to have patience.
Sorry, I was just going to jump in because I have seen some research that says that patients aren't looking for us to, dumb it down. That's not what we're trying to
Right.
do. They just want someone to help them understand some of the scientific jargon that we put in our reports. Because, of course, we speak this way because that is the most precise way for a pathologist, a radiologist, an oncologist, a dermatologist, for
Mhm.
all of your physicians to interact together.
Yeah, that's true. I haven't looked at that literature, but that would make sense to me because, but really, with some of our pathology terms, how simple can you get anyway? What I have
Mm-hmm.
seen some people advocate doing is writing an explanatory comment. So you write your
Mm-hmm.
regular thing, and then maybe at the bottom you have like a glossary or something like that, and a comment that explains what there is. I haven't gotten into that realm yet. But that's an interesting thing to see if that's going to happen in the future. But
Mm-hmm.
certainly in our practice, we're not doing that yet. Are you doing that?
No, we're not doing that yet either. And, there are groups of people working on trying to figure out ways to make more patient centered, patient
Report.
friendly pathology reports. There's also, there's tools out there that already exist on the interwebs. I'll have to come back in with the exact name, but I know there's
There's
one that is
one.
out of Canada. There's
Yes, that's what I was gonna
yes.
say. There's one out of Canada, my pathology report. We'll look it up and we'll be able to post a link. And they've really done revolutionary work on this kind of exercise. And it's worth taking a look at if you have questions. And I'm not saying don't Google or use ChatGPT, but be mindful that not everything you see is going to be accurate. Not everything you see is going to reflect exactly what your situation is. The best way to perhaps understand your pathology report is to actually do pre-work. right? So before you do the biopsy, before you do anything else, talk with your doctor then. When they say, I'm going to send you for a core biopsy of the breast, you should say, what does that mean? What kind of results should I expect to see? If I see this or if I see that, what do you think the implications of that are? Because it's possible that when that core biopsy of the breast pathology report comes out, you will see something, have some degree of anxiety, and then not immediately be able to reach that physician. So, and then if you go to Dr. Google, then you're going to get a panic attack. So, it might be a good idea to start with the pre work even before you get the procedure done.
Yeah, I was just going to jump in because I wanted to Google it. So there are some resources that exist, like mypathologyreport.ca. I believe there's a nice brief overview from the CAP about your pathology report. The American Cancer Society has an understanding your pathology report. There are resources out there that can help like walk you through the layout and some of the more common diagnoses you might see for certain tissue types out there.
We've talked about the final diagnosis and some of the logistics, but there are a few other pieces or parts of the report that you will see information in. The gross description is what we mean when we're describing exactly what we got. So if we got an apple, we might say we received a 10 by 5, that's a big apple, 5 centimeter apple shaped, green colored, that sort of thing. It's just basically what we got. And then we might say we section the apple into 7 slices and put in 6 cassettes. And that's just saying we got it. This is what it looks like. We took some pictures, we cut it up, and we sent it to be processed. And that's the gross. And then
Mhm.
sometimes there's like an ancillary section, and that tells you if we did anything special to help make a diagnosis. And all of that information feeds into the final diagnosis. So the bang for your buck is usually there. But if you also have a malignant diagnosis or a diagnosis of some types of tumor that may be kind of malignant or not quite as malignant as some of the more advanced tumors, but something that you might see borderline or that sort of thing, then you'll also see a section called a synoptic report, which is like a summary section of all of our findings. And many, many reports have that format these days. It can be on that first page, but sometimes you have to flip the page and you'll see more information in that section.
Synoptic reporting most often applies to cancers. So you'll see in that final diagnosis, for example, colonic adenocarcinoma, open parentheses, see synoptic report, close parentheses. And then there's going to be more information in that synoptic
Right,
report. That's what they're
right.
directing you towards. Yeah, synoptic reporting is a quite interesting tool that's been used more and more over time now. So it really is there to help ensure that the reporting is uniform across institutions. And so that helps, people like the NCCN and American Cancer Society gather data that can help us understand disease better as time moves on. So synoptic reporting is a quite wonderful, useful tool. Sometimes
So
a
sometimes,
very
oh, I know.
busy, makes a lot of work, but it can be quite, I see the benefits.
And sometimes duplicative. And you will hear varying viewpoints on synoptic reporting, but in general, it's a good place. That's an all-in-one summary of everything that we did find. So when you go to that, your oncologist, if you need one, will see all the data there. Your radiation oncologist, that sort of thing, all of that data is going to be there. So those are like general bones of your pathology report. Now, this part of the conversation was largely about patients and what you see and what you get. And I recognize that there's always going to be that tension between really fully being transparent with the data and the information so people have that, but also there's that line between we're transparent with it, we provide it, but do people understand it? And so for physicians and pathologists, it's good, but I do want to mention that there are a few groups that are trying to get the immediate release of these results being exempt because of this tension that exists, right? Patients are using it, but there's often no immediate review. And what's happened with it is that people start calling their doctors more often and much quicker. So there's an increased burden on doctors because the conversation you used to have when you said to a patient, I'll see you in a week when the pathology report results come back and I'll talk to you then. A lot of patients would wait. You go, you sit, you talk with the doctor, and you can have that conversation. These days, they get the report. The doctor may be busy with other patients, may be on vacation. They get the result. Immediately, they want to talk. So there's calls, there are messages. And so there's that line that can be hard to straddle, right?
Thankfully as well in this day and age of everyone having access to their electronic medical record, via portal. I mean, there are ways to send those questions if you do have them and just have to wait for them to get answered. And or just follow up in that follow up visit. Yeah, like I mean, it does. There's no question that it could enhance anxiety, but at the same time, it does enhance communication because now you're getting your results directly. I think one of the things we were talking about earlier. You mentioned as a patient, it's a good idea to save those results. If you get an important result, save it in your own files. Like get it off of your electronic portal and keep it in a computer portal or print it or whatever you need to do so that you have easy access to your information at all times. I mean, I kind of do that still. I don't know. What do you think about that?
So I think that's great. And I even before this, I used to tell people when people ask me what I did, and I would say, and then I would say, one of the biggest things I think you can do for yourself ever is save a copy of your path report, even if it's benign, even if there's nothing in there, because there may come a time when you have to tell a story. You have to say, oh, I had this, then I had that, then. And if you have a file that you have with all of this data, you don't necessarily have to log in. You don't have to, did you remember your password? It's all yours, and everybody should save it. I think it's a huge step towards health literacy, right? Which is kind of like a buzzword, but it's so significant because very often you are your own and your best advocate. Yeah.
Yeah, totally agree. I mean, I think that's where I think both, us pathologists, your other physicians, and what I'm hearing from the patient community is that everyone wants to get to this point of, you know, a basic amount of health literacy that helps you navigate the healthcare system because it can be a very large and confusing place.
It can be very daunting, right? Just even making appointments these days, I've been a patient multiple times. I have family members that are patients, and it never gets easier no matter what the condition. It feels like it's always getting harder. So,
Mm.
at least to have this information, that is the plus side. And a friend of mine, he has mentioned that sometimes even the bad news, it's easier to have a conversation with patients when they've already seen the bad news so
Hmm.
that by the time they come to talk to you about it, you have a better sense that yes, they at least have gotten over that initial shock, and now you're going to help ease their journey into some of the other aspects of care that you need to provide. So, overall, while I've had some kind of trepidation about it, I think it's generally speaking, it's a good thing and it's evolving. And one thing before we forget, I want to say to my fellow pathologists out there, not all of us are equipped or want to necessarily interface directly with patients, right? You have to know who you are. And I do think I have gotten cold call by patients, right? Like I pick up the phone and there's either a question, sometimes because I'm the lab director, it's not even my case. And I think if you are not comfortable talking to a patient, then you should be clear about that and be firm and definitely follow up with the patient's physician to let them know that they have questions.
Everyone works in healthcare teams these days. Communication is key. I'm going to take a step back. Pathologists, We kind of work behind the scenes. There's no question about that. Some of us don't. You'll find some pathologists out there who are doing their own FNAs, running apheresis clinics, doing bone marrows, very patient forward. But in general, we're kind of hanging out in the background, the majority of us. But that doesn't mean we don't like patients or don't like to communicate. Some people have those skill sets. Some people do not. And for those who don't have it but would like to have it, there are ways to work on that. Just to throw that out there.
It's funny that because I started my career in forensic pathology, you spend a lot of time that people wouldn't even realize that, right? But you spend a lot of time as a forensic pathologist talking to family,
Mm-hmm.
interfacing with the family of decedents. And so I think that prepared me in a way that it's interesting. I don't think residency ever did.
Yeah, no, I should have put that the number one on the top of patient-centered, patient-facing groups. You're 100%. Forensics for sure is, I mean, usually, come on, like when people think about pathology, they think about forensics first anyway.
So if you want to become a pathologist and think you don't want to talk to people, do not do forensic pathology.
That's pretty funny.
Guys, we want to tell you there are resources. So use them carefully, but they are no substitute, not any one of them, of having a good, clear, uh, communicative relationship with your personal physician. They
Hmm.
know you, they know who you are, they know what the best steps are going to be when they talk to you. So it is not a substitute. It can supplement, you can bring in information, but your new influencer on TikTok is not the person with your best interests at heart.
Right. I think you make a really important point there. When it comes to patient care, it's down to the individual. We've all heard about personalized medicine these days, and it's not just about the molecular behind it. It is about the person behind it,
Mhm.
knowing who you are, your history, your family, the resources you can bring to help you undergo your patient care journey. That's all so important in determining what your next steps will be when you get a diagnosis that isn't, benign, no pathologic diagnosis, unremarkable.
Or no
Keep the
significant
individual in it.
abnormality. We
Yeah.
love those. That's my favorite.
Yeah.
No significant abnormality. So we're gonna wrap up this session. If you have a question we didn't answer or a topic you think we should discuss, drop us a line below and stay tuned for our next podcast where I think, Juanita, we're gonna gab about maybe summer safety because we're in that season. Because, I've been thinking about this, and although we don't want raisins in the potato salad, we definitely don't want salmonella either. So we'll chat with you a little bit about that.
See
Stay
y'all next
tuned.
time.
See you next time.